Now streaming live on YouTube.
You guys see a message?
Yep.
Yep.
All right, I just need a link for a second so that way I can share that out. Do you guys see a link?
No.
No.
Yeah.
It says copy streaming link.
Okay.
I don't see.
It says link has been copied to my clipboard.
Yep, that's fine. I just want to get this to Sharif and Omaima. They can blast that out to everybody.
There it is, YouTube. Yep, I see the link.
Yep. Yep. Me too. Let's see.
All right, guys, let me just make sure everybody can see us.
Have you used the chloroquine and Calitra, or you guys have used it?
Chloroquine, I think we have 2 or 3 patients on.
Right.
2 patients on, because we're just waiting for the test results to come back.
Right.
We knew they were going to be positive. And Kavitra, we started on 1 patient.
I see.
Yeah.
All right, Assalamu alaikum, everyone.
Alaikum salam.
Amar and Dr. Esker, we are going to get started.
Islam.
All right. Okay, well, one more time. Assalamu alaikum, everyone. Bismillahir Rahmanir Rahim. We pray the ISCJ community and everyone is doing well, and everyone is in good iman, inshallah, during this trying times. So this is ISCJ's first attempt at doing a live program during the Corona crisis, and we wanted to give an update from the front lines with a couple of our community members, longtime community members. Inshallah, ISCJ is going to present a series of live webinars. This is our first one. And just be on the lookout in the days and weeks ahead. We have some things lined up with Faraz Khan. We're going to do maybe something with Shomail Malik. We'll also going to do a Saturday series every night with Imam Soheb Webb. Today, we're honored and fortunate to have with us 2 doctors on the front lines from our very own ISCJ community, Dr. Asfar Chuck and Dr. Amar Bukhari. Welcome, Dr. Chuck and Dr. Bukhari, to our program. And thank you for taking time out from your busy days to address our ISCJ community.
Assalamu alaikum. Thank you for having us.
Alaikum. Same.
So for those that don't know, Dr. Chuck is the Department Chief of Infectious Disease at Montefiore in Nyack and Good Samaritan Hospital at Safran. And Dr. Amar Bukhari is the Chief of Division of Pulmonary Care and Sleep Disorders at St. Peter's Hospital. All right, we're going to start with Dr. Chuck. Dr. Chuck, you're on the front lines in one of the areas that was hit the worst near Westchester, New York. Can you give us an idea of what you're seeing in the hospitals every day now and why this virus is spreading so rapidly?
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Thank you very much again for having us in these very trying times. So jumping right into the topic, yes, in Westchester, there was a surge of cases, and we're right next to Westchester. We're connected in Rockland County. So far in our county, we've had documented confirmed 57 cases. That number was from yesterday, so it might be a little bit more as we speak. The reason why this virus is spreading so rapidly is it is highly contagious. It has a tendency of staying on different surfaces, including metal surfaces, plastic surfaces, copper, so on and so forth. And it can also be airborne, as well as, go in the air, and we can breathe it, and it has a tendency of spreading quite rapidly. So this is what we're seeing in a nutshell. And that's why there's a surge. You could see other countries where, one person will have it, next day you'll see 4 or 5 people will have it, the next day you'll see 8. So there's an exponential increase in cases. So this is what's worrisome about this virus, and that's what we're seeing basically in this tri-state area.
Arthur, can't hear you speaking.
I couldn't hear you either. I'm sorry. Could you hear anything that I
Hey
said?
guys, all right, can you hear me now?
Yes.
Sorry about that, okay. All right, Amar, can you just answer the same question from a St. Peter's perspective and a local perspective? What are you guys seeing locally, and what measures are being taken by the hospital to address the growing pandemic?
So we have the same issue. We're starting to see a surge now of all the cases in the area. The number of cases have jumped considerably just in New Jersey alone. It increased by about 90 cases just from yesterday to today. So I don't think we've started to, by far, have started to see things level out so far. As you know, New Jersey's done quite a bit. The governor has declared it's a national emergency, it's a state emergency as well. And they've really limited the number of people moving around. As you know, there's a curfew now from 8 p.m. on, which is very important. From the hospital perspective, I can tell you, again, I work at St. Peter's. Robert Johnson is about a mile away. They're doing whatever they can. There are task forces that have been developed. We're meeting on a daily basis. There's daily communications. We're trying to figure out, we initially figured out what needs to be done for people coming in. And then as people come in, what needs to be done from there. So there's different things that are being done from, all perspectives, everything from providers who are taking care of people or patients, as well as people cleaning the, rooms, administration, everyone's been involved. So there's been organized task forces developed to tackle this problem.
All right. Before we got on, I'm just going to go off a little bit, and both you and Dr. Chuck were talking about the amount of beds and the ventilators, I think. Can you guys expand on that and help the general population understand what that means? Dr. Chuck, you can go.
Sure.
Yeah.
So it's an anticipation. We've seen other countries where this virus had already been spread before it made its way to the States. As I said, there was an exponential increase in patients with this COVID or coronavirus. And one of the main symptoms that we're seeing in these patients is they develop respiratory distress. They develop difficulty breathing. They end up requiring a ventilator. I'm sure Dr. Bukhari will expand on that more. So at this point, we're in the preparatory stages. We're anticipating a surge of patients who are going to come down with this virus, and a lot of them will require mechanical ventilator or respiratory support. So for them, we're trying to prepare as many ventilators as possible. The situation right now in Rockland County, where my practice is, we have near 80 ventilators in the county. However, there's potentially going to be a surge. There may be about 1,000 people that might be affected. So that's what we're trying to prepare for, to make sure these patients are adequately treated. One of my friends who is a critical care physician in Mount Sinai, she just told me that they just prepared 800 ventilators, 800 respirators in Mount Sinai. So in the anticipated surge, that's what they will do.
How are they able to do that in such a short amount of time, though? I imagine that's a very hard undertaking. And is that something that other hospitals in the area and the country need to replicate?
Right. So basically what they're trying to do is admit the very sick, if you will, at this point at the hospital. They're trying their best with patients who are already diagnosed with coronavirus or the COVID virus. They're trying to send them home, because as long as the patients are stable, they can certainly go home, they can take care of themselves, they can just quarantine. So again, as I said, we're in the preparatory mode at this point, and we're just trying to make sure we make more and more of the facility available when the very sick come in.
Amar, you want to tackle that from your side?
Yeah. So I'm a critical care physician as well, so I work in the intensive care units. We're preparing for people to be admitted to the intensive care unit where they need much more close supervision or observation. So a ventilator is a machine that helps people breathe when they cannot breathe on their own. So that's the ventilator talk that we were talking about earlier. Alhamdulillah, and inshallah, I should say, people, we won't need as many, although we don't know what the numbers are going to be. Only about 2 to 3% of people actually get sick to the point where they need assistance with breathing machines and all. So we're hoping the numbers are small, but if people do get that sick, that's why everyone's trying to ramp up and make sure that they have these breathing machines available to support patients until the body heals and things move on.
Okay, thanks, Dr. Amar. So one of the things that I'm following the YouTube comments, and I know Airborne was mentioned, and we do know it's Airborne, but can one of you explain Airborne just in layman's term and what does that mean? We hear a lot of the social distancing, and I think we could tie that into Airborne as well, right? If Amar, you want to tackle that one?
So as people have probably read or heard, you want to maintain about a 6-foot distance between people, and try not to be in large groups of people as well. So when I speak, you actually have small particles of liquid that I would send airborne, literally traveling through the air. And so that 6 feet is under normal speech, that's how far particles can travel. And so there's less likelihood of the virus than being in those particles and then someone else inhaling it. So that's only on normal conversation. But if people are coughing, that's different. So if they're coughing, they're doing something else that's going to accelerate that distance now becomes much longer. And that's why it's very important for people that are sick not to be around other people. They could have the common cold, or they could have influenza, because this is a very tough time, because this is the time where people are actually getting colds and getting influenza. And so that's the tough part about figuring out, do they have COVID, the coronavirus, or do they have a regular cold virus that's going on? And that's why we're telling people, if you're sick, you really should not be meeting people. You should just isolate yourself. It's only, as Dr. Chuck said, when if you got to the point where you're having difficulty breathing, because those are some of the typical signs and symptoms, of having a fever, having a cough, but then difficulty breathing. If you have a fever and a mild cough, you want to just isolate yourself, almost quarantine yourself. But if you have difficulty breathing, now it's getting much more of a challenge. And that could be because of a common cold virus, or it could be because of COVID. That's when you want to call your doctor and discuss it with your doctor first. Don't just show up somewhere, but talk to your doctor first.
Omar, you mentioned the flu season. Are we still in the flu season? Historically, was March considered flu season?
Yes. I can tell you in this area, we have seen influenza as late as May in the past 2 years. So this is still the flu season.
Okay, good to know. I think our audience, I know I didn't know that, so I hope everyone else appreciates that information. All right, Dr. Chuck, I'm going to go back to you. Reports have been published in the past couple of days that we're about 7 to 10 days behind Italy in our numbers of confirmed cases, and still with all the measures being taken, our numbers are growing. And you guys have already said the numbers are expected to grow. So what are the biggest challenges in the US is having in flattening the curve? We keep hearing that hashtag flattening the curve. And do you feel the public has finally got the message, and are we being cautious enough?
Let me see if I can flash a picture. I think this picture demonstrates it very well. Can you see this picture?
Yeah.
Okay, so you see the top where it shows one person, one person interacted with, let's say 2.5 people, if that person was infected. And then all of a sudden, I think the number is in 30 days, that person can potentially infect 406 people. In the second picture, it shows, if this person had interacted with, 1.5 or 1.25 person, in 30 days, he would or she would infect 15 people, so on and so forth. And then you could see in the last line of that picture, I think this is a pretty accurate description. So that's what social distancing, or rather, the term I like to use is physical distancing, right? Socially, I think we're still connected through the social media. So physical distancing would certainly accomplish that. This virus can stay with you in an asymptomatic stage. So I might be carrying it at this point, and I might be infecting my family at this point. But if I'm just staying at home and not interacting with other people, it's just staying with my family and not getting into the schools and masajid and malls and movie theaters and so on and so forth. So it's not exponentially going high. If we're keeping ourselves what we quarantine in the house, then it just stays within the house. So that's what the idea is about physical distancing from each other. And as Dr. Bukhari had mentioned, if you keep at least 6 feet the airborne distance amongst each other, the likelihood of somebody else getting it goes significantly much lower. So that's what the idea is behind that.
Is your feeling that the community and the general public truly understands this, though? The physical distance, the social distance, whatever we want to call it? Or you think there's a segment of the population that's not taking it seriously? It's not a big deal.
Yeah, I think significant people, even educated ones, they're not taking it seriously. I think you saw a few politicians saying that no, the economy is going to get worse. Just go out, go to the restaurants, go to the movie theaters. Please keep the economy going this way. But we obviously have a bigger problem, and many people would aspire to that point of view. And yes, there's a lot of education that we still need to give to the general public, and hopefully these type of forums will help.
Okay, inshallah. So for all the ISCJ community, Central Jersey community, and New Jersey that are watching this right now, take heed. It seems like we're not taking it seriously enough, and pass that message along to all your friends, your family, your neighbors through social messaging, but not physical messaging, right? So pass that message along, everyone. Amar, I want to circle back with you. We have many elders in our community, right? In the Central Jersey, ISCJ, MBIC, MCGP, and Lawrenceville, et cetera, et cetera. And can you elaborate on the reports that people over the age of 60 are at the highest risk? And what advice can you give to our beloved elders?
So I would, tell them first and foremost is to not go out if you don't need to. Do not go out for elective things. Things have been set up so, and many businesses have set things up so they can deliver food to your home and all. So just routine going out, interacting with people is not what you want to do right now. The reason, and this is, again, I'm going to make the analogy with flu. People very young in that case tend to get much sicker. And so same thing with COVID. It seems to be affecting people who are older with underlying illnesses. When I say underlying illnesses, I mean diabetes, I mean lung disease, heart disease. And so those people need to be even extra cautious. So don't go out, don't invite people to the house because one, you don't know where they've been. You don't know if they're sick. People, think they have a cough and that's all it is. It's just the usual cough, but this is unfortunately not the time. just as we're doing right now. And I think this is where, technology can really help us. I think that if you can FaceTime somebody and you can communicate with them and interact with them, this is the best thing that you can do right now, as opposed to, hey, let's meet up together, let's go out together, those kind of things. And so that's why people who are older than 60, especially with underlying illnesses, need to be extra cautious.
Okay, thanks, Amar. So there's been a lot of talk about the symptoms, right? There's different symptoms. Is it a combination of the symptoms that should concern us as individuals and as families? Or like if you have one symptom of, let's say, a cough or a fever, is that an indication, hey, let's go see our primary care physician? Or is it a combination of 2 or 3 of them before we go to the primary care physician? Dr. Chuck.
So I would just reiterate what Dr. Bukhari said earlier. Right now, most of the physicians, what they're encouraging is not even doing an office visit. They're just trying to triage these patients on the phone. So this is what we're doing, and many of the local practices, that's what they're trying to do. Again, just to maintain that physical distance, social, minimize the social interaction. So what they're doing is over the phone, they would ask the symptoms. So the most common symptoms typically are fever is considered the most common symptom, followed by cough, typically a dry cough, body aches. Then there's some other symptoms as well, but these are the 3 most common symptoms. And we try to triage them over the phone. If the patient, again, as Dr. Bukhari mentioned, if they're not sick enough, if they don't have other medical problems, such as what were mentioned earlier, heart disease, lung disease, immunocompromised state, if they don't have that, we just tell them to stay at home, just rest, hydrate yourself, and just quarantine yourself. If the patient is not doing well, I mean, they're deteriorating, we try to triage them to the emergency room, but we always give the emergency room a heads up. So the best thing is to reach out to your physician over the phone. Don't show up to their office, over the phone, and let them discuss that with you, and then they'll put you through the proper channel thereafter.
Okay, that's good information, Dr. Chuck. Thank you very much. The other question, Dr. Chuck, I wanted to ask you here is, what can we do proactively in terms of building up our immunity systems, immunity that we have, right? And to perhaps fight off a potential infection of COVID. What are some of the steps? We see and hear so many different things. Everyone is on WhatsApp and social media, and you get all these other things, gargle this or take this and vitamin C this or whatever it is. Can you talk to that? And what are some of the legitimate, viable things that we can do as individuals to increase our immunity?
So universally, what you would see is the recommendation is hand washing, universally. Like any website, CDC, department, does not matter. Universally, everybody would mention hand washing. So again, the Islamic concept of wudu. I mean, if you do wudu 5 times a day, you're washing your hands at least 15 times a day, at least. That in itself will be very helpful in preventing this disease from spreading more. What we're encouraging people is wash your hands with soap and water for at least 20 seconds, at least. What one of my, what a scholar that I know, what he had said was, recite the Ayatul Kursi while you're washing your hands. That would be 20 seconds. So that's one thing that we're strongly encouraging. The best thing, I'm not sure if there's anything specific that is medically proven to build your immunity, but there's many things that you can do to make sure your immunity stays in a healthy state, such as not smoking, exercising regularly, eating a balanced diet. All these things will keep your immunity strong. Certain vitamins as well. I mean, there's certain studies on vitamin C. Maybe Dr. Bukhari can expand on that more, but again, I don't think there's anything proven that will certainly boost up the immunity.
I would agree with Dr. Chuck there, and then I would also add getting adequate sleep. I know many people are sort of stuck in their home. but still be active in the home. You know, try and exercise, do whatever you can. And I think that's very important. And there is good data on when you are sleep deprived, you're more susceptible to getting infections, more so viral, done a while ago. So getting adequate sleep. So just because you're at home, don't stay up late, don't wake up early and lose your sleep. And I think that's a very important part of it as well.
Absolutely.
Yeah, very good. It seems like common sense, but sometimes it's not so common if we're not doing it, right?
That's right.
Right.
That's
Somebody
right.
else has said that to me before. It might have been you, Omar.
That's one of my phrases.
There you go. You didn't trademark it. Amar, how can we as a Muslim community be a model for the American public now and help during this time of distress?
You know, I look back historically, I think that Muslims have led the way in many fields in the past, you know, art, science, and I think we can be, you know, outstanding citizens when it comes to this as well. I credit ISCJ for even taking the step forward to, you know, close down shop essentially, to limit the amount of exposure to people. I think that's a very important thing. And I was, you know, it was heartwarming. And, you know, I think just as I saw an email by South Brunswick, I'm on their email list, you know, that ISCJ is closed. And I thought that was big because I think that that's how we can lead. Because, you know, as government is telling us we really do need to shut down, you know, this is very big for the community. But I think the community should not take it in a negative way. The positive way to take it is, hey, we are taking the lead on this. We're going to show that, yes, this is our house of worship, but we also are hearing and we believe in science that, you know, this is a problem. So we're going to take a lead on this and close, you know, the masjid down so we don't congregate and we don't have the potential to spread more disease. That's the one thing that's been said over and over again.
That's a valid point. I know the leadership of all the masajids have been faced with the difficult decisions and how do we operate the masjid, and may Allah reward all of them.
I mean,
and trying to do their best to serve the community in the best interest of the community. We got a lot of questions on YouTube. So Amar and Dr. Chuck, you're not done yet. So hopefully your family is okay with you spending some more time with the community here online with us.
I think they're used to it.
Alhamdulillah. Make sure the people that are watching us, make sure you guys make a sincere dua afterwards for the families of all the doctors in our communities and all the health professionals in our communities that are serving the broader community throughout the country and throughout the world, actually. Alhamdulillah. So one of the questions I'm reading off here is, any update on COVID-19 and its impact on pregnant women and an unborn child?
So I was actually reading something on Department of Health and CDC website. It's because St. Peter's does a lot of deliveries and we have a process in place as well. It's not absolutely known what the transmission rate is. There have been cases as early as, I think I read 17 days where a newborn you know, was exposed and tested positive for the coronavirus. And again, very, very important. And, you know, it's a very difficult situation because you need to have mother and baby together. But if mother is infected, there is, you know, chance of transmission to the baby as well. And so, you know, we want to keep mother and baby together as much as possible, but not when, you know, there's a chance of harm to the baby. It's very important to keep them separated.
Okay, thanks, Amar. Appreciate that. Dr. Chuck, I'll give you the next question. This is around the physical distancing, social distancing. We're saying, I haven't seen it in New Jersey, but I've seen videos across the country actually of this where people are praying in jama'ats 3 feet apart or 6 feet apart. But if that particle in the air, wouldn't it eventually someone breathe it after they've done the salah and walking through that same area?
right, absolutely. I think it's a very good point that was brought up earlier as well. You know, we don't know for sure, but typically the airborne particles don't stay in the air for too long, but the challenge with COVID is that it can stay on the surfaces for a long period of time, and you can come in contact with the surfaces. Yes, we've seen those pictures as well, but I think, again, it was a very bold step that overwhelming majority of the masajid took. I think the appropriate thing is just to have that social distancing and just closing them down and not having that you know, the interaction where the virus can pass on to somebody else. I think that's probably the best thing to do at this point.
Okay, good. Amar, I have a question here, which I don't understand, but I'm sure you'll make sense of it. I'm assuming it's related to the ventilators, but the question is, can a CPAP machine help in any way?
So CPAP, just for everybody, it's a non-invasive ventilator, so which means you don't have a tube that goes down your throat hooked up to a breathing machine. This is a small breathing machine by a mask, and the person is awake and just pushes air in, or either a continuous way or in different pressures. So the recommendation by, and actually it's not by this, I don't know if it's on the CDC, but a lot of the literature that came out of Italy and China recommended not using these non-invasive means because there's more chance of, you know, spreading the virus, and it'll be aerosolized much more so. So we would not use that as the intermediary, as we often do as our standard of care when people are sick and they're having some difficulty with their breathing. So we're going essentially to intubating people. And again, that all goes back to making sure that we have enough ventilators available. We have all, you know, all the people to support the ventilators. So for that person who asked that question, obviously knows something about either sleep or hospital medicine. And so we would not use those kind of intermediary steps. Okay,
thank you. Dr. Chuck, any advice about using ibuprofen use? I think there's been some news recently about ibuprofen, so if you can elaborate on that.
Right. So again, data is somewhat limited, but it's shown to it showed some adverse effects. Just like there's a couple of antihypertensives that have shown some adverse effects as well in this. So for the time being, the best thing is just to avoid it. Just speak to your physician before taking anything. So we are encouraging to avoid ibuprofen, but for the time being.
Can you be reinfected if you've had COVID-19? So I'm assuming this it means is, okay, you recovered, can you catch it again?
So it's, and Dr. Chuck can, you know, offer his opinion as well. Based on my reading, we don't know. It's just too early. And the information that we don't have that information available from China, South Korea, Iran, or Italy, where there was an abundance of cases. So we don't know the answer to that because there is some, the body does fight it and contain it. So I do not have the answer to that. Dr. Chuck, I don't know if you know anything different.
I don't as well. I mean, again, it's very early stages of the disease, but I read that there was one person that they suspected was reinfected. One. So out of the 197,000 cases so far, there was one that they suspect was reinfected. And not in America, all over the world.
Okay. I believe we've covered this next question, but I think it's worth reinforcing because many of us, most of our community, are part of a family, obviously. But what are the precautions when you're taking care of somebody sick in the household itself? Are there, special, I'm drawing a blank right now, but what are some precautions that we can take if we're tending to a sick family member?
It was Dr. Chuck's turn or my turn?
Eeny, meeny, miny, Amar.
I can start. So if somebody's sick in the house, and again, if it's, as long as they're not having significant symptoms of shortness of breath or something more than that, where they need to, and they can still contact their provider or go urgently to the hospital. Then if they're just taking care of, what looks like a cold or something, and again, could be COVID, could be influenza, could be just a common cold virus, you still want to take precautions. You want to have that person, cough or sneeze into tissues. Those tissues get thrown away. You use fresh tissues if you have to cough and sneeze again. For the individuals that are taking care of that person, you wash your hands regularly. You don't want to be in their line of cough or, again, you want to maintain your distance as well. So, give them food, give them comfort, anything else, but you still have to be cautious about being very close to them, and also contact, that's very, very important as well.
Different rooms even, right? I would imagine.
So yeah, so a lot of these, even the cold virus, influenza, all of these are things that can be passed along. So yes, you want to distance yourself as much as possible. And so yes, if you're sleeping in the same room, there's a greater likelihood that it will get passed along.
Okay. And
may I just add one more point? It was absolutely right on spot, but just one more point, which I don't think the community is really educated on. There's in the medical field, there's a cough etiquette. So we always mention, and this is the way to cough: put your elbow, cover your nose and your mouth, and then cough in there rather than coughing like this. So that's a crucial point. I think if one thing the community can learn from this, I think inshallah it will go a long way in prevention of these common cold viruses that Dr. Bukhari just mentioned. So again, cover your face and cough in your elbow.
okay. Amar, it's going to be your turn again. Are the masks, I guess the N94, 95 masks, are
Right.
they useful for going out in public?
So one, again, just limit the amount of, when you go out, that's very important. And two, you don't need to wear, an N95 or, the surgical mask, just walking around doing your, if you have to go out and get something done. So if no one is around you, they're not going to be beneficial. We talked about the 6 feet. We talked about not shaking hands, not touching. Those are all very important. And if you do go out and you touch a railing, you touch doorknobs, washing your hands. So the masks are not going to be beneficial in that case, especially if they're not, no one's around you.
Yeah, because I think if anybody that goes out now in the public, I've actually seen myself, more and more people are wearing masks. But that's good to know that it's not going to help in the case of if you're still touching other things.
Correct.
Okay. You guys still good? Because we got questions still coming in on YouTube, so I'm going to keep going if that's okay.
I'm fine.
Yes.
All right. If you have symptoms that may be COVID-19, how long after the symptoms are gone should you wait before being safe around others? Dr. Chuck?
So there are different views on this, and I think the opinions are changing on a regular basis. I think initially, and for the most part, they're still saying 14 days. But in New York State, I'm not sure if this is the case in New Jersey as well. They relaxed it a little bit. They said it needs 72 hours of a symptom-free state. So, let's say your symptoms resolve in 3 days, 3 more days after that. But again, they change. Right now, I think the safest thing is 14 days. That's what, for the most part, unless it's anything different in New Jersey State.
No, it's the same thing. And you know what? Things are closed anyway. You're not going anywhere.
Right.
So take the extra precaution and stay indoors.
Exactly.
Is conjunctivitis part of the symptoms? Could that be a symptom of COVID?
So not a typical symptom. So conjunctivitis is, when people talk about infections of the eye, that's not a typical symptom that has been presented in the literature.
Okay. And I think we answered this already. Is fever an early sign of COVID or only after an infection?
So first 5 days, you can have no symptoms at all. That's what the tricky thing is with this virus. First 5 days, you can have no symptoms. But yes, fever overall is the most common symptom of the COVID-19.
Okay. All right. Alhamdulillah. I think we'll end with the questions where Dr. Amar and Dr. Bukhari, before I allow you guys to both sign off, I do want to ask is what is the one absolute takeaway that you want our community to know, as we wind down this session? So I'm sure we covered a lot of ground. Some of it is new stuff. Some of it is maybe a rehash, but one absolute item that you want everyone to take away with. We'll start with you, Dr. Chuck.
Bismillah. So again, this is a test from Allah. Inshallah, may Allah make us, come out of this in the best possible way. Something I was just reflecting with my wife last night. I think the overall society had just become so confined to the house for the past couple of years, right? Everything was social media driven, social media dependent. Everything was being ordered. You know, we were just staying at home on our Xboxes, on internet, Netflix. You know, these were all the things that that we were basically doing for the past couple of years. So now we're asked to do that, right? And we're having a problem with that. So maybe this is a sign from Allah. You know, we should enjoy the outdoors. So inshallah, once all this is said and done, inshallah, you know, maybe we should go back to our natural fitra, you know, of going outdoors and interacting with the community and whatnot. So I think we had already kind of moved away from that. So inshallah, maybe this would be a lesson that we can come back to it. But anyway, leaving that part aside, the medical aspect, the three things that we're stressing on is hand washing, and hand washing. You know, that's one way this virus is going to spread. Now, the other things that we're doing in addition to that is the physical distancing that Dr. Bukhari mentioned so many times. You know, that will prevent the spread of this virus. And last but not least, what I mentioned about the etiquette, the cough etiquette. Inshallah, if we can take home those three things, inshallah, we'll defeat this together.
Inshallah. Well said. Well said. Thank you so much. Amar.
So again, I think the key is, I think each person has to do their job. This is not somebody else's problem. This is everybody's problem. And so I think everything that you've heard tonight and read about, you know, you go to reputable sites, you know, you go to New Jersey Department of Health, and also CDC. You know, it's very important to gain all that information, and it's, I think, our responsibility. You know, you tie your camel, you take on the responsibility of doing what you have to do as your part, and if everyone does that, inshallah, we will contain this.
Inshallah. Amen.
Inshallah. Thank you. So, Dr. Chuck, Dr. Bukhari, I really appreciate it. The community appreciates all your invaluable advice and information. For the community, thank you everyone for tuning in. We pray this was a helpful session for all of you, and please stay tuned for more beneficial programming from ISCJ in the next few days. And also participate, be engaged on the social media platforms, not only for ISCJ, but all the Central Jersey, all the New Jersey masajids in the area. We're very blessed, we're very lucky, alhamdulillah, to be surrounded by such great institutions, organizations, leaders, scholars, professionals. So it is an absolute blessing. It's, you know, what I always like to say, hashtag one community. And, you know, it's, you know, there's a reason why people love Central Jersey. And this is just one of many reasons why everyone loves Central Jersey. For the people, again, be on the lookout. I mentioned this earlier in the start, and I know a lot of people have joined and rejoined, come in midstream, is we're going, inshallah, you know, I think maybe we should have, not maybe, I'll say that we'll have Dr. Amar and Dr. Usker come back maybe in a week or 10 days. Maybe we can give another update to the community as things progress. But we're going to also have different programming also, just so you guys know. We're going to have stuff, really cool things coming up with Faraz. He's going to do a virtual paint night. We're going to have story time with the Sahaba. You know, Shomel's going to do some stuff. And then for anyone that didn't catch this, Imam Soheb Webb, we're going to start a Saturday night series for the next 4 weeks. It's going to be really awesome. And we're going to do all this and much, much more. And your respective masajid will be doing other things too. So again, we're one community, and let's support and help each other the best we can. Inshallah. May Allah protect us and keep us all healthy, inshallah. Assalamu alaikum, everyone.
Wa alaikum assalam.